In tonight's Health Edge, do birth control pills hold cancer-fighting powers?
A new study saying oral contraceptives have prevented 200,000 cases of endometrial cancer within the last decade. Chief Health Editor Dr. Nandi is here now with more on this.
Yeah, it's huge. I think a lot of people watching. This research was just published in The Lancet and covers several decades. So the study finds that every 5 years you use the pill, your risk of endometrial and uterine cancer is cut by about a quarter. So if you're taking the pill for 10 to 15 years, that cuts your risk in half. And get this, some of that effect continued for over 30 years, even when women stopped taking the pill. It's so big deal. You know, we knew a little bit about this, but I think this study really puts more light into it.
Well, it does, because you hear about all the side effects, and that concerns us. But what about the low hormone pills?
Yeah, so a lot of times because of the side effects, the level of estrogen has gone down. But this study shows that even with the low estrogen pill, which is about a quarter like it used to be, you still reduce the risk of endometrial cancer. This study looked at, everybody way before the low estrogen pills were developed. But now, even with current pills, the endometrial cancer risk is decreased. So I think it's not for everybody, though. I think we should talk to your doctor.
So you're not recommending that all women go and say, hey, I want to go on the pill because it can help with this?
And like everything else you see on Channel 7, it's to have a conversation with your doctor. Say, listen, I watched on WXYZ that, my risk of endometrial cancer is cut by half. But also ask your doctor, I also heard that, guess what? Your risk of blood clots are increased. The risk of stroke can be increased.
Oh.
The risk of heart disease can be increased. You can have breast cancer increases. How do you then balance it out with your life? So if you obviously want to not get pregnant, and that's the overriding factor, are those risks, not outweighing the benefits? So you got to have a conversation. It's not like one or the other. But this is nice, is that you're talking about that the birth control pills may actually, even at the dose we're giving today, may have a benefit.
So, Doc, if you stop taking your pill, do those risks go away right away?
Yeah, the blood clot risk and the stroke goes away right away, but the other risks may stay depending on the studies you look at. But I think, again, talk to your doctor, find out there are other types of contraception. We talked before, it's not just the birth control pill, there are other types of contraception that you can have, and talk to your partner. It is a decision a man and a woman has to make. Sometimes we as men put the responsibility squarely on women. So, if there are risks involved, and you talk to your partner, talk to your husband, talk to your boyfriend, say, listen, you know what, I learned this on Channel 7. What can we do together to make this happen? And then come to a decision with your doctor.
Good advice. Yes. There are other options.
Exactly.
Thank you, Dr. Nandi.
Thank you. Appreciate it.
And if you have a question or health concern for the good doctor, you can email him at drnandi@wxyz.com or send it to us on Facebook or Twitter.